We've all heard the saying, just rip the Band-Aid off. But as a certified wound ostomy and continence nurse, I put a lot of tape on a lot of people, and I'm here to tell you, don't just rip the Band-Aid off. In this video, we're going to cover a few handy tricks of the trade for preventing pain and skin injury from medical adhesives or tape. First, we're going to talk about sensitivity or allergic reaction. As a wound ostomy nurse, I tend to think of tapes in three categories. The first is acrylate adhesives, and this category has the most products and is what people usually think of when they think of medical adhesives. This category contains athletic tape, silk tape, paper tape, plastic tape, fabric tape, and you guessed it, Band-Aids. The important thing to note is that if someone has an allergy or a sensitivity reaction to one of these tapes, they will have some type of reaction to all of them. And just like any other allergen or sensitivity, the reaction depends on the dose or exposure. With medical adhesives, we control dose and exposure by two main ways. The first is duration. So the 12th time you put a Band-Aid on your cut finger, you're more likely to have a reaction than the first time. And the second way is breathability. Tapes that are less breathable expose the skin to more of the chemicals within the tape. So that's why you hear a lot of people say, oh, I can only use paper tape. Because of the acrylate adhesives, paper tape is one of the more breathables. The second type of adhesives are hydrocolloids. Hydrocolloids are just as sticky as acrylate adhesives, but they have a completely different chemical makeup. So if someone has an allergic reaction or a sensitivity to an acrylate adhesive, they won't have the same reaction to hydrocolloids. Hydrocolloids stick by bonding to the skin, so warming them up first is really helpful. You can find these over the counter. You just want to make sure you're looking for hydrocolloid on the package. The third type of adhesives are silicones, and these stick by conforming to the little ridges within the skin. These have the weakest bond, but they're the most gentle, so just keep that in mind when you're using them. And again, you can find these over the counter. Just make sure you're looking for the word silicone on the package. The second way to prevent skin injury from medical adhesives is the way you remove them. There are two really important things. First, you want to remove slowly, and secondly, you want to think about holding the tape and pulling the skin away from the tape rather than the tape away from the skin. Thanks for watching, and remember, don't just rip the Band-Aid off.